topic that we chose was meningitis. Meningitis is caused by the bacteria Neisseria meningitidis, which is part of the Neisseria family. Neisseria meningitidis is a gram-negative bacteria, and it is diplococci shaped, which is two cocci put together, and it is encapsulated and does not form spores. Since it is gram-negative, we know that it has a thin peptidoglycan layer and has an outer lipid membrane. And on a gram stain, it will appear red because it does not absorb crystal violet. So if we look to the left, we can see Neisseria meningitidis under a microscope, and we can see that it has two cocci fused together, and it is said to resemble a kidney bean. And on the right, we have results of a gram stain, so we can see the small bacteria over here are red, and these are our Neisseria meningitidis. And because they are gram negative, they do not absorb the crystal violet. Neisseria meningitidis is also oxidase positive and catalase positive. The oxidase test is used to determine bacteria that have to use oxygen as the final electron acceptor in aerobic respiration. Specifically, it tests for the presence of the enzyme cytochrome oxidase. The catalase test tests for the presence of catalase, which we know is an enzyme that breaks down hydrogen peroxide into water and oxygen. It also has 13 serogroups, and a fun fact is that serogroups A, B, C, W, 135, and Y account for about 90% of the epidemics that we have seen involving meningitis. The bacteria itself contains pili, which aids in meningeal invasion. So this picture down here, we can see all the pili sticking off, and it helps stick to cells and invade cells in the body. Some virulence factors is that it contains a capsule, it has outer membrane proteins, and it has an endotoxin, which induces sepsis in the body. Neisseria meningitidis is usually found in the upper respiratory tract of humans because it is warm there, and the incubation period in the body is 1 to 7 days, and you can get it from other people who have it through direct contact with droplets.
So in this portion of the video, we'll be going over the diagnoses of how we go over bacterial meningitis, specifically in the bacterial sector with Neisseria meningitidis. So when a patient comes in, what do you order when they say that they have symptoms of such, which they probably have Googled already? First, you probably want to order some blood work, so specifically blood cultures and a complete blood count, otherwise called a CBC, a CT of the head, which is imaging that shows exactly what's going on inside, would also be useful, and doing a procedure called a lumbar puncture would also be helpful to look at the internal surroundings of the brain and the spinal cord, which are affected during these infections. So a CT head will show any of the apparent swelling or inflammation going on. As you can see over here, there's the difference in the brains, which is kind of classic, which gives that kind of headachy feel of the different issues with meningitis specifically. So another thing that can be ordered are blood cultures and a CBC or a complete blood count. When you're looking at the blood cultures, you can see if there's any bacteria which is contained in the blood, which would be able to get to the cerebrospinal fluid, as it does surround it, though they don't usually cross unless there's some other sort of pathology going on. The blood cultures will grow the specific type of bacteria that's found in the blood, but also with the CBC, you're looking at the different components of the blood, specifically in this case, white blood cells. When you're looking for the source of the infection, especially with infections of the cavities of the body that you don't really want to play with, such as that contains the brain and the cranial cavity, you don't really want to go straight for being like, yes, it is an infection of the brain. So you have to look through other ways. And one of the ways is looking at the components of the white blood cell count, or the WBC count of the blood. Neutrophils are usually elevated in bacterial infections, which would indicate the bacterial infections such as Neisseria, and then also looking to see if the meningitis is caused by a viral infection, which would increase the count of lymphocytes. So the last thing that you could do specifically to look in this cavity of the cranial cavity, make sure that, you know, you're addressing all of the possible things, is doing a lumbar puncture, which allows you to get to the cerebral spinal fluid, or the CSF, of the body and be able to specifically look at that. So this is done by asking the patient to lay near the side of the bed or sit on the side of the bed and arch their back forward to open up the vertebral spaces to be able to stick a needle through there and puncture the spinal cord to get a sample of that cerebral spinal fluid. So there's usually a needle that is inserted between the third and fourth lumbar vertebrae. But first, usually a lidocaine anesthetic is injected to the area to make sure it's not as painful for the patient. So when they get this sample of CSF, they're looking at specific things. So one thing that can be done is the pressure. When the needle is stuck in, there's a little meter that will measure that for you. And different things mean, or different measurements mean different things. But usually with the bacterial, you can see a little over normal, but with viral meningitis, you'll see it up a little bit. It's usually not severely changed unless there's an SAH, which is a subarachnoid hemorrhage, which obviously is not indicative of any kind of meningitis. So specifically what's looked at here is what is in the CSF. So you're looking for purulence, which is the detection of like bacteria or infection. It's like the yellowy or pussy color of the CSF. And that is indicative of a bacterial infection, while usually with a viral infection, it'll be clear due to the presence of the bacteria and the waste and things that also go along with that. But another thing you have to look at is if there's a white blood cell count. So the white blood cell count inside the cerebral spinal fluid will tell you if your body's trying to react to like an invader into your brain and essentially the cranial cavity. So again, which is also indicative in the CBC, is also indicative in the CSF analysis that neutrophils will be present more with the bacterial infection and Neisseria infections rather than the predominant lymphocytes. Another thing that can be done is cultures, which we've done in lab. Obviously, you just culture the specimen onto a plate and see what grows, followed usually by a PCR to identify it exactly. Though this is helpful, it does take a while, I mean up to 3 days, to be able to grow these bacteria sufficiently to be able to identify them. But if you look on the photo on the left on the bottom, you can see the small little colonies. Though being able to see these helps, specifically the cultures are usually more specific, especially for antibiotic treatments. Being able to pick that specific antibiotic is important to be able to treat the patient.
Hi, today we're going to be talking about the cause of meningococcal meningitis. Meningococcal meningitis is caused by the bacterium Neisseria meningitidis. This bacteria is rarely found in 1 in 10 people. It's commonly found in the nose and the throat. When it's found there, it's not harmful. This picture represents how Neisseria meningitidis is found in 1 in 10 people. People who have this bacterium are considered carriers. This bacterium could invade the body and cause illnesses, and that is when it's considered meningococcal meningitis. Meningococcal meningitis can cause infections in various parts of the body. These include the skin, the gastrointestinal tract, the respiratory tract, etc. Neisseria meningitidis could spread through the bloodstream and to the nervous system, which is where it causes meningococcal meningitis. So how could meningococcal meningitis be spread? In order to spread this bacterium, 2 people must be very close. This is because it's not a contagious bacterium. It's not like the flu where the germs can be spread very quickly like that. It's very different. Meningococcal meningitis could be spread to other people by sharing respiratory and throat secretions. This is also known as saliva and spit. And this could be shared through coughing and kissing. So who's at high risk for catching this disease? So people who are at high risk is people who are in the same household, their roommates, and anyone the patient has shared oral secretions with. So this could include like parents, siblings, any family members, or just like college roommates, or boyfriends and girlfriends, because how you usually kiss them, it'll be spread that way. So on the left of this picture, it just shows how meningococcal meningitis could be spread through kissing, and then on the right, it shows how it could be spread through coughing.
The two types of diseases caused by Neisseria meningitidis are meningococcal meningitis and meningococcal septicemia. When Neisseria meningitis infects the lining of the brain and spinal cord, this can lead to swelling. This is known as meningococcal meningitis. The symptoms include fever, headache, stiff neck, nausea, vomiting, photophobia, and an altered mental status. However, in babies and young children, these symptoms are difficult to notice. You might notice symptoms as them being slow or inactive, feeding poorly, or bulging in the soft spot of their skull, also known as the anterior fontanelle. In meningococcal septicemia, this is when Neisseria meningitidis enters the bloodstream and then multiplies. This results in damaging of the walls of blood vessels and leading to bleeding in the skin and organs. These symptoms include fever and chills, fatigue, vomiting, cold hands and feet, severe aches, pains in the muscles and the joints, chest, or abdomen, rapid breathing, diarrhea, and in the later stages, a dark purple rash will be visible on the skin surface. This is a diagram comparing both types of diseases, and as you can see, the symptoms they both share are very sleepy and vacant, high fever, confused and delirious, and vomiting. Everyone is able to be exposed to Neisseria meningitidis. People have a higher risk of being exposed if they travel often. The meningitis belt is in Africa, and this is an area in Africa where the rates of disease caused by Neisseria meningitidis are the greatest.
Okay, now we're going to be talking about treatment of meningitis. And the most important thing about treatment is that antibiotic treatment is started immediately. We cannot be waiting for diagnostics to come back with what type of bacteria is causing it. We must immediately start antibiotic treatment. So when a patient comes in, a blood culture will be obtained, and that will help with the identification of the pathogen. And then empirical therapy needs to be started before we even get the results from the blood culture. So if you look at this chart, this is an example of empirical therapy. And if you look on the left, there are different age groups and also other conditions that a patient might be in. And then in the middle, we have the probable pathogens. And I've highlighted the Neisseria meningitidis, which is what we're focusing on, and then some empirical therapies. A common therapy is penicillin G, and it's given intravenously. And if it is to be used on its own, so as a monotherapy, that's recommended only after the confirmation of the identity of meningitis. So it can be used in conjunction with other antibiotics before then, but to be used on its own, it should be after we know what is causing the meningitis. The following doses are for under 1 year old, 300 milligrams, 1 to 9 years old, 600, and 10 years old is 1200. Most cases are going to require treatment for 10 to 14 days, but if the treatment is extremely uncomplicated, then it could be completed within 5 to 7 days. And now the first 24 hours of treatment, a patient should be isolated, and anyone who's been in close contact should undergo chemoprevention therapy. For patients who do not improve within 48 hours, they must undergo cerebral imaging and repeated lumbar puncture to assess the antibiotic treatment, see what's going on, if anything's wrong with it. Corticosteroids are still being tested, but they have been used in conjunction with antibiotics, and they have been quite helpful. In a double-blind randomized controlled trial consisting of 301 adults, it was found that the use of corticosteroids with antibiotics, not alone, they still need the antibiotics, will reduce brain edema, intracranial hypertension, meningeal inflammation, hearing loss, and even the mortality rate. And the first steroid treatment should be within 10 to 20 minutes before starting the antibiotic treatment. So like I said, it's very important that as soon as we can identify that it is meningitis, that the treatment is started immediately, and then we can work from there to figure out what is causing the meningitis.